of the Council of the District of Columbia. I'm Phil Mendelson, Chairman of the Council and Chair of the Committee of the Whole. Today is Thursday, January 21st, 2021. The time is 1:12 in the afternoon, and this hearing is being held virtually over the Zoom video conference broadcast platform. It's also being broadcast on Council Channel 13. It is also available on the DC Council website, which is www.dccouncil.us. And I believe it may also be streamed on Facebook. Excuse me, on YouTube. The subject of this hearing is reopening District of Columbia Public Schools. I'm going to read from the hearing notice. The purpose of this roundtable is to hear from District of Columbia Public Schools, from DCPS leadership on the proposed plan to increase the number of students who will return to in-person instruction for term 3. Term 3 begins February 1st. This roundtable will be an opportunity for DCPS leadership to provide clarity on a plan to move forward with and improve distance learning while welcoming students back to in-person instruction safely during the pandemic. In addition, DCPS has announced the launch of their Reopen Community Core, a diverse group of school-level stakeholders that convenes at every elementary school and will support and advise school leaders in understanding learning models and impacts on the community for reopening. The Committee of the Whole would like to hear more about the outcomes of the Community Core across district and its impact on DCPS's plan to partially reopen on February 1st. We had a deadline by which witnesses had to sign up to be able to testify. And we also indicated in the hearing notice that the number of public witnesses would be limited. We have 50 witnesses who are registered. I think actually it's 49 because several dropped off. And I'm hopeful that we will have about 2 hours at the end of this hearing, which is scheduled from 1 to 6. About 2 hours to hear testimony from the Chancellor of the Public Schools. And I'm told that about 5 o'clock will be a representative from the Department of Health, so that if council members have questions concerning reopening and public health guidance with regard to the schools, there will be somebody from the Department of Health late in this hearing. I'm going to recognize other colleagues if they have opening statements, which I would appreciate if they would be kept brief, and then I will call the first 15 witnesses. Councilmember Gray, do you have an opening statement? You are muted, Mr. Gray.
Am I unmuted now, Mr. Chairman?
Yes, you are. You are unmuted now.
Well, thank you very much. I want to express my appreciation to you for calling today's roundtable, which I view as one in a logical series of roundtables concerning the state of public education during this public health emergency and global pandemic on distance learning, reopening schools and the return to in-person learning. I think everyone would agree that in-person education is more effective, but it must be done in a safe manner and in a way that is transparent and earns the trust of all stakeholders, especially our students, their families, and the teachers who are instructing them. As DCPS now plans to have in-person learning for all grades starting in the 3rd term in the midst of rising rates of COVID-19 nationwide, today's roundtable is especially timely. I want to thank today's witnesses for their continuing engagement, and I look forward, Mr. Chairman, to hearing about, discussing DCPS's plans and their preparedness for serving our children once again in their schools. So thank you, Mr. Chairman.
Thank you, Councilmember Gray. Councilmember Trayon White, do you have an opening statement?
Yes, I do, Chairman. Thank you. Returning to in-person instruction is a delicate issue. It's important that we strike a balance and weigh the value between safety and students and teachers and the education of our students. We already know that experts have been warning us that COVID-19 cases will continue to rise and that we should prepare for dark days ahead. I believe I read something that said there were 400,000 deaths as relates to COVID across the nation, and 25% of those happen in December. Um, and so as we think about those statistics, we have to be very cautious and careful of how we move forward. We witnessed a increase during the holiday season. We also know that the vaccines are becoming available. DC Health only anticipates that they will be able to have availability for teachers on January the 25th. What happens if they're not available on that date? We know that immunity is not immediate. And what about the students? Even with the safety precautions in place on school campuses, we have seen that these particular practices are not fail-proof. The availability of rapid COVID-19 tests on campus for students as staff are showing symptoms are helpful to help them get out of the class immediately, but what kind of preventative measures will be taken? So I have a lot of questions and concerns. I heard from parents, teachers who are uncomfortable about returning to in-person instruction, and there are those who are eager to get back to in-person instruction and who are not doing well doing digital learning. And so we're just trying to figure out how do we transition. And so I'm eager to hear from those stakeholders today and my colleagues, and also I hear you said Department of Health. But we have to have a healthy balance to ensure that we can prepare for quality and safe education here in the district. I look forward to hearing. Thank you, Chairman.
Thank you, Councilmember White. Councilmember McDuffie, if you have an opening statement.
Thank you, Mr. Chairman. I do briefly, I want to thank you for holding this some public roundtable. And I know that we're here to hear from parents and teachers and other members of our school communities. And I look forward to doing that. During the previous council period, back in October of last year, you all held a hearing of the Committee of the Whole. And it was, I think productive in the sense that we got to hear from folks, but I think that the same questions that were raised then and many accounts still ring true now. And I think there's still some answers that folks are looking for. At that roundtable, I urged DCPS to model its reopening plan with an eye towards racial equity. I also urged DCPS to engage more with the public and stakeholders to provide greater transparency around their decision-making processes. I think a successful reopening plan is one that prioritizes equity and builds public trust through engagement and communication. I think that while some strides have been made, I know that the chancellor, our teachers, both in DCPS as well as in DC public charter schools, have been working with parents and students and my colleagues tirelessly to try to prepare for in-person learning. And I know that we're all doing our best in each of our respective corners to help each other through this pandemic. I think sometimes we get it right, and I think sometimes we miss the mark. I think there's some areas that we have not yet covered that we need to. And just as everybody's been impacted by this pandemic, some have been impacted more than others. And so we need to make sure that we're doing everything that we can to address the challenges that are facing our students and our parents so we can get them back to in-person. I think that everybody would agree that in-person learning is the best setting for our kids to learn. And so this is a very important discussion that's going to happen today. I look forward to hearing from all the folks who signed up to testify. And I look forward to hearing from DCPS about how we're going to do better for our children, our parents, and our teachers, and our entire school community. Thanks, Mr. Chairman.
Thank you, Councilmember McDuffie. Councilmember Lewis George, do you have an opening statement?
Yes, thank you, Chairman, for hosting this, and I will keep it short. But, I do think it says something that we're holding this hearing remotely while requiring our teachers to return in-person learning assignments in less than 2 weeks. And I want to express my gratitude for our teachers and school staff and healthcare workers and families, and particularly our students for their strength in this difficult time. I was pleased to see Tuesday's announcement of the partnership with Children's National Hospital to begin offering first round dosage to DCPS teachers and support staff. But I'm interested to learn more about how DCPS is planning to keep families and staff safe during this reopening. Our current daily case rate is above 20 new cases per 100,000 residents, which puts us in the CDC's yellow or category of transmission in schools. A recent study looked at what extent in-person schooling contributes to the spread of COVID-19 in both Michigan and Washington state, and researchers have found that opening schools in areas with greater than 20 new daily cases per 100,000 students, increased case counts in those communities. We've seen from the case notification letters that were sent home by DCPS that already, even in limited care classroom offerings, dozens of letters have gone home to families sharing news that someone in the building has tested positive for the virus. So I'm interested to hear about specific community spread metrics DCPS is using to evaluate whether it's safe to reopen schools and whether to keep them open. We've seen others in our region. When we talk about a regional strategy, we've seen others in our region, like Montgomery County, recently pull back from reopening in the midst of COVID spread. And when I say specific metrics, I don't mean CDC guidance or Aussie health and safety guidance, because I've looked at those and they don't include specific community spread metrics on which to base decisions. I'm talking about things like Alexandria City's decision matrix indicators, which were transparent science-based metrics used to inform whether or not it's safe to open schools. And so I've heard from families and staff, and I know that this is a complex issue, but I want to make sure that we are opening schools when it is safe, and especially when our teachers and educators have the opportunity to receive the vaccine, and we know that it can be effective. Thank you for allowing this hearing to happen, Chairman.
Thank you, Councilmember Janice Charge. Councilmember Silverman, if you have an opening statement.
Yes, good afternoon, Mr. Chairman, and good afternoon to my colleagues, and certainly to all those who are testifying today. I see there's a large number of participants, Mr. Chairman, and that is because how we reopen schools, and when we reopen, and what fashion we reopen is one of the most critical decisions that we need to make during this pandemic. And I think the community involvement in this hearing is indicative of how important it is. We need to make this decision not only as a government, but as a community. And I will just note that I think the community's participation and perception of our reopening process so far has been chaotic, not very transparent, and one in which information is often limited and hard to decipher, and that needs to change. In 2 weeks, in less than 2 weeks now, we'll be bringing back students and teachers to every school in the system. And I just want to note, because I don't think it has been noted by colleagues, that the parent surveys, the community surveys of DCPS do show a deep divide. And the divide is often by race and by ward in the parental willingness and interest in returning to in-classroom learning. And I think we need to understand this better. Meanwhile, some of our public charter schools have started school this year in person, and while others have remained virtual. And again, I thought the point of our charter experiment was to sort of understand, use them as experiments in understanding. And I'd be interested in knowing, for example, what's worked and what hasn't, but that information hasn't been that plentiful either. I'll just say, Mr. Chairman, I know that your focus on the education committee or putting education within the COW is really to do oversight, which I agree with. So I have a lot of questions, and I'll just put those up front. And it gets to some of the things that Councilmember McDuffie was talking about with equity. Who is being served in person? Who is learning at home? Looking at the demographic data there. Are our public schools doing enough to support students furthest from opportunity? What have we learned about how to support students through this pandemic? As was noted, a lot of students are still going to remain in a virtual learning environment. So how can we improve that? And certainly, what have we learned about how to keep our students, family, and staff safe? I will just note that on the chaotic nature of reopening and the lack of information, it was news to me that DCPS had 3 schools, Brent, Ross, and Kimball in Ward 7, that have brought some teachers back before the February reopening in an experiment.